Hi, this is Dr. Eric Westman for Adapt Your Life, and today's topic is LDL cholesterol. Before we get to the topic, I hope you have on your calendar October for the Adapt Keto events. October 5, the Adapt team will be in Tempe, Arizona for the Adapt Keto Arizona. I hope to see you there. Adapt events are ways to connect community leaders with community followers of the keto diet. They're fun. There are hundreds of people at these events who come together on a Saturday. You don't have to travel far. You don't have to pay a whole lot of money. So join us for an Adapt event in October. After Arizona, the following weekend, October 12, we will be here in Raleigh, North Carolina, where I practice at Duke University, over on the NC State campus in the McKimmon Center. Hope you can join us there. And then the Adapt team travels back west to Texas and will be in San Antonio, Texas on October 19th. So 3 Saturdays in October. Hope to see you at an Adapt Keto event, and the signups are below this video. So what about LDL cholesterol? I get a lot of patients asking me about this, and the best I can say is that there's an old way to look at the blood cholesterol markers, and there's a new way. The old way focused on looking at the total cholesterol and the LDL cholesterol. In fact, we were all taught that LDL meant lousy for L for lousy, or L for lethal. And the problem is that these are just risk factors, even in the old way and the new way. It's not like you're on the edge of a cliff and will be falling off, although a lot of doctors will make you feel like you're on the edge of a cliff, and that if you don't address it or take a medicine for it, you'll be in dire consequences, like tomorrow. No, risk factors exert their effect over a period of time. And the old way of looking at total cholesterol and LDL cholesterol, I think, is valid. But there's a new way that it's actually always been there, but it's new because most doctors and patients don't know about it. And that's looking at the triglyceride and HDL cholesterol. So when someone comes to me worried about an LDL, or they come with a high LDL, wondering if they can do a keto diet, it's okay. In fact, 2/3 of the time, all of these markers look better on a keto diet. Those are the easy visits where I can just say, hey, look, even the old way and the new way looks better. About 1/3 of the time, and this is assuming that you've changed the diet and you've reached your goal with weight loss, because during weight loss, these markers can go up and they really don't mean the same thing. So you don't want to check the LDL and the total cholesterol until you're at your goal. And most people come to me for diabetes or obesity treatment. But if the LDL is high, it's okay to do the keto diet. Remember, 2/3 of the time, everything gets better. So not everyone gets worse. Most of the time it gets better. 1/3 of the time, let's assume you're at your goal and the LDL cholesterol is still high. But the triglyceride and the HDL, the new way to look at these markers, are better or optimal, meaning that their triglyceride is very low and the HDL is high. And we like to have that ratio to be about 1-to-1. You want your HDL to be as high as the triglyceride is low. So, 70-70 would be a great number to have. And it's not a perfect indicator of all the metabolic problems, but it's a good one, a very good one. And so the new way of looking at the metabolic factors reflect what's called insulin resistance and the metabolic syndrome. This is thought to be the cause of atherosclerosis, hardening of the arteries, strokes, heart attacks, all the problems we're trying to fix, even looking at the old way of cholesterol. And so some people argue that they're both valid ways to reduce the risk of heart disease. I think that's the way I look at it. We just reduce the heart risk factors in a different way than the old way. So don't worry, don't be concerned if your old total and LDLs don't look so good, but your triglyceride and HDL do look really good. And I'll take time to even go over all the other risk factors for heart disease. In fact, that's age, high blood pressure, whether you smoke or not, your gender, and your race. These are, of course, you can't change those, but these are also factors, and there are even online programs that you can put in your information. One of the most popular ones, based on a current American College of Cardiology guideline, is called cvriskcalculator.com. C as in Charlie, V as in Victor, riskcalculator.com. So if you're not sure, you get your numbers, you plug them in there, and you can see what your risk is over the next 10 years of having a stroke or a heart problem or a heart attack. So there's an old way to look at the blood markers. There's a new way when you take the cholesterol into consideration. And I hope that's helpful. Don't immediately knee-jerk reaction into some panic reaction when you look at a blood test. These are risk factors. It's not like you're on the edge of a cliff. I hope to see you in October in Tempe, Arizona, October 5th, Raleigh, North Carolina, October 12th, and then back to San Antonio, Texas on the 19th. Until the next time,